Well, I needed a routine medical procedure, so I went to our HR, and I'm fairly new, so I asked what the options were, and they said that they gave me WellBridge as an option for the multiple procedures they do, but I don't know if you want to talk about a colonoscopy, but I don't mind it. My age, and I've had diverticulitis in the past, so I thought WellBridge, it didn't sound real. At first, they weren't going to charge me. When folks go and have a medical procedure performed, at least my family will get a bill from the doctor. We'll get a bill from the room. We'll get a bill from anesthesia. We get bills, and some of them are mediated out. Some of them, you don't know what you're going to pay. When I went into WellBridge, I had my procedure done. I've not received a piece of paper owing anything since, which is very nice.
Well, I guess kind of the overarching kind of desire for what we're doing at WellBridge is to change the kind of consumer attitude within Hoosier healthcare to be from passive healthcare consumers to active healthcare consumers. So WellBridge Surgical was founded in 2021. So first case was December 2nd, 2021. We did one case that first month, and then one case that first week, 2 cases that next week, and then it's kind of took off from there. But the reason why we started WellBridge was because I'd been an anesthesiologist for years and years in the health systems. So my experience was with health systems, and in the health system, you're not getting high quality, low cost. And so what we wanted to do was to offer that to individuals, to health plans, to really to everybody, all Hoosiers. And so we decided to break off and just have an independent surgery center that could offer one bundled price for a surgery, make it really simple. You go online, you can see how much it costs to get your gallbladder taken out, and they are not getting surprise billed. You got one bill that includes the anesthesiologist, the pathologist, the surgeon, and the facility all in one. And so we're unique in that manner, and there's no other way to access that if you're a Hoosier healthcare patient, Hoosier patient. We were able to be the first to offer that, and I think the only to offer that here right now. What we do is, we're able to take the best surgeons that we had worked with in the past, bring them to participate at WellBridge, and offer the same procedure with the best surgeons, the best staff, and to do it at really what turned out to be half the cost. In our experience, when when you go to employers, there's a whole pie of how much their claims is going to be. And outpatient surgery is, maybe 20% of that pie. The more pieces of that pie that you can get, yep, and the more pieces of the pie you can offer to help and to save the employer, it increases your value prop, and yep, you have more value to the customer, who is the self-funded employer. So it's just it's a big help. It's kind of like a 1 + 1 = 3 thing. I think waking up in the morning now is different than when I had just the anesthesia job that I was working at the hospital system. And that's why we did this, right? We did this because we know that we're at the end of the day, we're doing a good thing. We're able to make a change in Hoosier healthcare, and be able to see the faces see the patients' faces, and make a difference in their lives, saying, hey, now I have access to healthcare that otherwise I probably wouldn't have had access to, because the 50% less expensive procedure, and all the while knowing that we're giving them a higher quality product too. So it's something that just kind of makes you feel good about what you're doing, and that's part of the reason, not all the reason, but part of the reason why we did this. One of the reasons we started WellBridge was so that we would have that extra motivation in the morning to wake up, get up, and go say, hey, I'm going to see, on the patient's faces, I'm going to see, a smile, because we're able to, maybe offer a procedure to them that they otherwise would not have had access to. for several different reasons, through their employer, self-pay. What we offer is a bundled, transparent price that they can see, and that price is about half the cost of what they could get it anywhere else around here. And so it's extra access to healthcare, and all the while, the patients, I think, they notice it with the patient experience, but from the physician side, knowing that we're offering them a superior product, a high quality product, in terms of medical terms, outcomes. That's important to me. I think it's important to all of us here who come in to work. And so we've, some of the folks that we've had come in from the hospital, the staff that we have here, they take ownership over their jobs, and they, it's just nice to see that we're kind of all a team here that's working towards the same goal. Yeah, I think it kind of goes back to the fact that you want people here paying a bunch more for people just to come here and work. You want people to have that motivation, like I have, and like the physicians have, like the founders have when we started this, to say we're doing something different here, and we're not overseen by the hospital system. We're able to do it our way, and in many ways that's a better way, and able to offer better quality product. That's kind of who we're looking for. As far as the pool that we're pulling from, we had a lot of experience at many different facilities, and so we're able to pull the folks from there who are kind of like-minded. In 10 years, I see WellBridge as not being just WellBridge Indianapolis. I see having different sites, maybe throughout Indiana, around the Midwest. What we know is that we're growing pretty rapidly here. We know that there's a lot of self-funded employers around everywhere, around the nation, and there is a need for this everywhere. So what I believe is that just the sheer numbers of the patients that would be helped by a WellBridge, it would necessitate at least a few different locations, at least around Indiana, and then hopefully further. When patients leave WellBridge after a procedure, my hope is that they have realized that this is different from a hospital. The feel is different, the care is different, and certainly the payment model is different. But and different, yeah, sure, different can be good or bad. Different in a good way, and I think that the minute you walk in, you can tell this isn't a hospital. It doesn't look like one, doesn't smell like one. It's different. You're not treated as a number, but you're treated as a patient. And so that's what I'd hope patients would feel when they come, when they leave WellBridge. Zero tiering is kind of a word that we phrase that's how we work with self-funded, self-insured plans, self-insured healthcare plans. And so zero tiering would be if we go to a client and say, hey, we have this product to offer, and they ask, well, how are we going to get our patients, how are we going to get our members to actually choose to go to WellBridge? Because it's a choice still. And so one of the things that we do is when we work with clients, they will generally build WellBridge into their plan as a zero tier benefit to their members. And so what that means is it's zero out of pocket, so zero co-insurance, zero deductible, if that patient would choose WellBridge as a side of service. The reason that works is because, say you're going to say the plan is going to save $10,000 on a gallbladder removal, and the patient would have owed $4,000. Well, if the employer waives that $4,000, then they just netted themselves $6,000, 10 minus 4. And so it's a kind of a financial mechanism to make a win-win-win situation for the member, the plan, and WellBridge. The best way to kind of get the word out about WellBridge is from patients. If a new client comes by, signs up with WellBridge to zero tier with WellBridge to have that benefit. A lot of times it's the HR director. They'll have if they've got a procedure, they'll have the procedure, and then they'll be able to say, hey, I've done this, and it is different. It's a good place to go, and it's a good experience, good outcomes. So I think that as we grow, and each of our clients, start to have more patients come through the benefit process, we have already noticed that kind of word travels, and so that's how it goes.